Hello all! In this video I'm going to talk about evidence-based practice in social work. I think an easy way to understand evidence-based practice is to look at how we develop medicines in this modern day and age, or vaccines for that matter. The way new medicine is tested is that you usually provide the medicine to one group, and then you have a control group that doesn't get the medicine or the vaccine. And then after a while, when you think that the medicine has had its effects, you look at the outcomes in these two groups. And if there is a difference between the outcomes between the group that got the medicine or the vaccine or the group that didn't get the medicine or the vaccine. And to apply this thought model in social work is all about understanding social work methods as standardized interventions that you can test by providing one group of people in certain circumstances social work intervention, and then you have a control group that doesn't receive the same intervention, and then you compare the outcomes of these two groups. An obvious and widely debated challenge when it comes to applying evidence-based practice thinking in social work is all about the fact that it's obviously much more difficult to standardize a social intervention than it is to standardize a medicine or a vaccine. Because social intervention is always conducted by a human being, and the way we do our work is usually not standardized. We have all our different ways of doing social work. Obviously, social work is done in very different contexts, and that can be something that makes it all more complicated. And lastly, social work is also conducted with different clients who can have a different approach or understanding about social work. Some clients can be very cooperative, and some people perhaps encounter social workers in circumstances where they don't appreciate that much social work. So it's obviously a different thing to test and evaluate social interventions than a medicine pill or a vaccine. As Malcolm Payne elegantly writes in an early edition of his book Modern Social Work Theory, evidence-based practice is based on optimal behavior in a planned and organized environment. Life is not like that. But still, also as Payne argues, social work can benefit from evidence-based practices if you understand both its possibilities and its limits. And in this video I want to share my thoughts on 4 things that I think are good when it comes to evidence-based practice, 4 things that I think, or 4 reasons why I think evidence-based practices can be and perhaps should be implemented in social work. First of all, evidence-based practice provides a framework that really highlights the need to look at social work practice in practice. That is all about the situational activity when social workers meet their clients. And overall, I think there is too little research about this practice that actually occurs, for instance, in a social office. And by doing social work research based on evidence-based practices, that is very much about looking at what actually happens in a social work situation when social workers apply some method, for instance. And I think this kind of information is extremely important, extremely crucial for various reasons. Perhaps most of all, I think that's a very good way to learn about social work, to really understand what plays a difference in a social work encounter. Secondly, I think evidence-based practices provides a framework that helps us to understand what is the crucial, important element in social work or in a social work intervention. Obviously, it is very difficult to standardize social work practices, but I think we can pinpoint the crucial element in one approach. For instance, when it comes to systemic child protection, I think there are some elements that are very, very important for the approach to be sufficient. So I think social workers and social work in general benefits from trying to pinpoint and understand what really plays difference when it comes to applying a social work model or social work intervention. And I think these crucial elements can be pinpointed and examined by using evidence-based rhetoric when it comes to evaluating or testing social work methods. Thirdly, I think social work overall would benefit from having it tested. I think social work is very often targeted by insufficient cutbacks, for instance by policymakers, and therefore I think it would be good if social workers would welcome these kind of approaches where we really look at how social work actually works. And fourthly and lastly, and I say this with all my love to the profession, I think social work would benefit from generating a more systematic approach when it comes to conducting social work overall. In short, I think social work would not hurt from strengthening the more systematic approaches, as we are quite good at being flexible and spontaneous. But I think the world needs also social workers that can work more plan-based and with more systematic approaches. And I think also this idea of being systematical is also very important, particularly if we try to develop an understanding about what social work is and what is actually effective when it comes to social work or social workers' professional conduct. But I think that's all I wanted to say about social work and evidence-based practices. I think my core message is that I think social workers should be open-minded to evidence-based practices. And overall, I think it's quite misfortunate that we have quite strong dichotomies about evidence-based practices in social work. So I think we should be open-minded and also think that social work would benefit from evidence-based practice, or there is a place for evidence-based practices also in social work, even though I can understand its limits. That's all for now. Hope this was understandable and interesting, and I hope to see you soon again. Have a nice day. Bye.